Hello everybody, Keith Tenhundfeld, nurse practitioner, health and wellness expert, coming to you with another great topic. Today is gut health. What is gut health? Gut health is a very important topic to talk about today, because if you think what the gut does for you, it does everything, right? It produces your immune system, it helps you regulate your digestion, it produces hormones for you to feel good, to sleep, all those fancy things. And sometimes our guts are messed up, especially if you're dealing with anything with the American diet. Some people might have irritable bowel syndrome, as they want to call it, mixed diarrhea, mixed constipation. Some people have bloating after they eat. Some people just have horrible GI distress in general, or abdominal pain and cramping for no reason. Otherwise, some people might just have general inflammation, joint aches and body aches, because their gut's a mess. So let's talk about gut health and what we can do to get that tuned up. Number one, having fermented foods in your diet is one way to really help out with your diet. For instance, sauerkraut and yogurt and probiotics are all fermentables, and they can do a really good job help balancing the gut with good bacteria. Now, sometimes you have too much bad bacteria, and bad bacteria is very common, especially along the lines of E. coli, streptococcus, and staphylococcus. And you're saying, well, how do I manage that? And that is sometimes very easily well managed with oregano oil, berberine, monolaurine. Those are some really good ones. If you need to move into more of a parasite detox, you got the artemisinin and wormwood and walnut. So managing the gut also has to do with managing your stress, because stress can cause a lot of hormones to come in there, and not to mention a hyperactive GI system such as peristalsis because of stress, and that can cause usually diarrhea symptoms. Managing your stress, as we talked about before, can be simply just making sure you're getting a good sleep, making sure your vitamin D levels are high, and also reminding yourself that you're safe. When you're moving through the process of gut diagnosing, say you're going to your doctor and they're having a hard time figuring out what it is, I do recommend that you order two things. A GI map, have them order a GI map. If they've got something like Rupa Health, they can order it through them. And I should say food allergy testing, which is a blood test, and they can usually test 200 to 300 different types of foods that says, hey, maybe you should reconsider when you're eating these type of foods. Once you find out those two informations, you can throw them into an AI algorithm, and it'll give you kind of an idea what you're up against and what you can do to help treat that naturally. Go through the program, usually takes about 6 weeks. At the same time, you're eliminating the foods that your body doesn't like, and you'll start to see things perk up, such as better bowel movements, less GI distress, maybe even better sleep. So that's my kind of hint there. So please make sure that when you're doing a GI workup, that you try to get a GI map and a food allergy testing. Most blood testing really doesn't show you gut dysbiosis to begin with, so note that. I will tell you that the 3 top allergens that are showing up on my food allergy patients is milk, eggs, and gluten.